thought I could have my turn. I thought I was getting my turn now. Where's my turn? But let me tell you, sir. Let me tell you. But you're throwing everything at me so that I can't offer any response.
No, but I get an opportunity. You're doing an interview, so let me respond to your question.
Why don't you just do a soliloquy? Okay, you just take it away.
Okay, this is the way interviews work. You ask a question, then I get to answer.
Oh,
when
thank
you. Put your commentaries.
Well, believe it or not, that was almost 3 years ago. Then New York Congressman Anthony Weiner and I were discussing that particular example, the Supreme Court case on the constitutionality of health care. Or were we? Or maybe, I can't remember what we were discussing. Health care. But the political landscape has changed a lot since then. Tonight, for the first time on the Kelly File, Congressman Weiner is back to join us to discuss the upcoming midterms and more. Congressman Weiner, great to see you.
It's so great to see you again. You know, you forget one of your very first shows when you were doing the midday. I came on as a guest.
I remember that. You were live on the set, and now it's been 3 years since I've seen. What have you been up to?
Not much going on. Just
What's happened since
then? Little this and that. We're doing okay. You're doing great. I'm so proud to see how great you're doing. This is a beautiful set, a great show.
Thank you very much.
Thanks for having me back.
You know, I comment on this publicly. Every time something unfortunate happened in your political career, I was on maternity leave. And since we had sparred so often prior to that point, I really felt you were doing it intentionally every time I went on maternity leave.
Just didn't want to give you the satisfaction.
I had that sense. How are you?
I'm well.
Do you feel like the American public is forgiving?
I think that people are decent. You know, when you walk down the street and you've had a moment that, I'm fairly well known in New York City, and people come up to me and they say variations of, good luck to you. I mean, people are very nice. Now, we do live in an environment where people do talk a lot about the big fights. You and I learned that firsthand, that we could have a civil conversation about Obamacare where no one interrupts anybody and no one will be talking about it. You and I get into a little bit of a dust-up and it's all over the place. Putting that aside, basically, Republicans, Democrats, people are decent. They don't want bad things to happen to their neighbors. They want bad things to happen to you, and they're very kind to me, to me and my wife. And I love this city, and I still get letters every day from people saying, go get him. But I also, obviously, there's a lot of snark out there, too.
Especially now they see the current mayor, who's to the left of you. Let me ask you about one of the things we talked about a lot was Obamacare. And now a lot's happened since, you and I were having those discussions, including last year, the, quote, lie of the year, according to the PolitiFact, was the president's, if you like your plan, you can keep your plan, period. Do you agree that the American public was misled on that?
Well, look, the American people has been misled by a lot of elements of this. I came on Fox News shows all the time where people talk about death panels, which was obviously a lie.
I know, but that sounds like a dodge. Like,
that was the beginning of a thought. Let me just finish the thought. So there's been a lot of elements of this discussion that people have been unclear on and maybe not given the honest truth about. The fundamentals of what the president was saying is right, in that the idea is that they made a decision to not go with the single-payer healthcare system like Medicare for all Americans.
You were advocating for that all
like I wanted, and went with an insurance, an employer-based plan. In the past, present, and to some degree the future, people are still going to lose their health care plans. And he should have made it clear. And he
didn't.
He should have made it clear that under my bill, it's going to happen less. Maybe not never happen, but it's going to happen less.
This is all a dodge. What he said was not correct. And the thing, here's what I'm going for. There's been no accountability. The president came out and was forced to admit that he had misstated the facts to the American people. But where's the accountability for that misstatement, for the failed rollout of healthcare.gov?
What do you mean the accountability?
To explain. I knew, and this is why I said,
frankly,
to take responsibility for how it went down.
The president, you can accuse him of a lot of things, not taking responsibility. He publicly apologized for making that statement, explained the context that he made it in, but let's
well, the Wall Street Journal was reporting that they knew at the White House that this was going to happen, and they made a political decision to mislead.
There was, frankly, I've already said to you, and the president's already said, that it should have been stated differently. But there is this notion that that is the sum and substance of the conversation. The healthcare industry for years has been taking away people's coverage willy-nilly in huge numbers.
There was no question that something needed to be done.
Hold on. So the law that was passed was a Republican proposal.
I get that, but I don't want to relitigate the whole healthcare law. You and I have done that many, many times. I'm just trying to get to
sometimes the beginning of my answers lead to an end that is going to answer your question.
Here we go again.
So the point that I'd like to continue to make is that, yes, as I've said now twice on your show, that the president has said, But remember something, the status quo is many, many more people losing their health insurance willingly.
I understand.
And so that, I think, should be the focus, because that's what the law succeeded in doing.
With the problems that we've seen with the health care law, some people are suggesting, including our own Charles Krauthammer, that this is a blow
Someone who I listen to on health care policy.
There you go. Well, you should. That progressivism has taken a hit, that this is a strike at the heart of big government, because people are less inclined now than ever to hand their health care, to hand matters over to the feds.
Over to the feds. It's private insurance. We're giving citizens...
Who's running it?
Let me just... The insurance industry.
Whose law was this? Who forced
every
people?
Every law is the law of the legislature. A law that cuts taxes is the law of the legislature.
Who misled people? Who rolled out healthcare.gov?
Can I answer your first question before we get to the next three? The point is, we're not giving... What we're doing, we're giving people subsidies to buy private insurance. That is a Republican principle and ideal.
Let's shift bases now, because you're not answering my question.
As
usual. Some things change in 3 years, and some things don't change at all. Let me ask you about this.
Polite to say I didn't answer a question when I just got done answering. You're not being polite.
You keep focusing on the states. I'm asking you about healthcare.gov. They're not running that.
It's a state-federal shared responsibility.
They're not running that. The states are running. All right.
No, the state healthcare.gov is a shared state-federal responsibility.
You've made your point. It's just as irritating as it used to be. But kind of fun, too. It's kind of a weird combo that he and I have had for many, many years now. We did two parts. That was part one. Part two, we're going to air on Monday. And in that, I ask him flat out about what I've said publicly about him many times, which is I didn't understand, I've never understood how he could show such hubris on the air in his interviews with me and others when he was walking around harboring such a secret. How is that possible? How could he go out there like that? Why? I've never understood it. And we had a very robust exchange on that. Set the DVR for Monday night, 9 o'clock.